Hello, and thank you so much for listening to The Act of Courage, a global health podcast series brought to you by Capracare, Inc. Capracare is a global health nonprofit that's bringing health care to the people of Haiti. I'm Jo Ann. I am the International Service Chair of the Prospect Goshen Rotary Club located in Louisville, Kentucky. And I'm here with Jean-Pierre Louise, my co-host, as well as the founder and executive director of Capracare. During this third season, Jean and I will be talking with one another and others in the know about how Capracare, with Rotary's help, has brought cervical cancer screenings to the women of southern Haiti, saving lives. We'll talk about the journey. We'll talk about where we hope to go. We'll talk about where we are now. And we are thrilled that you're on the journey with us. Thank you. And welcome to episode 2, Reining in Cervical Cancer, what we're doing about it, and what is the science behind it. In our first episode, you might recall, we talked about how Capracare and the Prospect Goshen Rotary Club began its collaboration together in an effort to rein in cervical cancer in Haiti. Today, we are going to focus in on the screening methods that we are using or can be used to detect cervical cancer, the science behind them, and why it is so important that we continue this work. Jean and I are very grateful that we have with us today 2 women of Haiti, both of whom are familiar with cervical cancer screenings and are familiar with Capracare. We have Dr. Helene Nau, who is a family practitioner, and she is a member of the Capracare board of directors. She also has a practice in both Miami and Broward County in Florida. And we have also with us Dr. Sophia Lubin, a first-generation Haitian American who is an OBGYN practicing in New York City, and like Dr. Lubin, a board member of Capracare. Dr. Sophia and Dr. Helene, welcome. We're thrilled you're here.
Hi, and thank you for having me. I'm happy to be here.
Thank you for having me as well.
Great, great. And we're going to make you work for the next 30 to 45 minutes to educate the rest of us about what we're actually trying to do in Haiti and why it works. But before we do that, both of you, Dr. Sophia, Dr. Helene, you both, you have impeccable credentials. Your accomplishments are beyond impressive. All that information is available on the Capracare website. What I really want to know from the both of you is, how did you meet Jean-Pierre Louise? How did he ever get you involved in Capracare? And Dr. Helene, I think we'll start with you.
Well, JPL is not one who says no. So he fished me from an award ceremony where I was receiving an award secondary to my work in Haiti and in Florida with educating people on how to protect themselves from COVID and how to, try to weather the storm that was bestowed upon us. and he was relentless in I'm gonna say harassing me. He's like, you got to get involved, you got to get involved, you can't say no, you got to get involved. I'm like, dude, seriously, I don't have time. He's like, but it's not gonna take that much time. We just need you to come in. We just need, you have a lot to give us. And I'm gonna say harassing me. He's like, you gotta get involved. You gotta get involved. You can't say no. You gotta get involved. I'm like, dude, seriously, I don't have time. He's like, but it's not gonna take that much time. We just need you to come in. We just need, you have a lot to give us. It's not gonna take too much time. And before I knew it, I was there. And before I knew it, I found myself in Haiti. Before I knew it, it's been what, 2-3 years now. So here we are. He just didn't let go. He just didn't let go.
And you've been the happiest since.
I don't know about happiest because we have equations that we have yet to solve.
But you're at least a part of that equation. What a deal, huh? What a deal. Dr. Sophia, do you have a similar story?
I definitely have a similar story. We actually have a friend in common who is also a member of Capracare, and he introduced us. And once he introduced us, and he said, "Oh, you've done work in Haiti, around cervical cancer. Great. So happy you've come on board." And I was like, "Wait a minute. I thought this was just an introduction."
Are you still friends?
And then from there, I was kind of roped into this board membership and plan on how we're gonna be a part of the eradication of cervical cancer in Haiti. So a big task, of course. And definitely, as Dr. Helen has already said, JP doesn't take no for an answer. So he's pretty persistent. He's very good at, sending you text messages and then voice notes and then, text more messages.
Oftentimes when I'm talking with Rotary groups, trying to inspire them to get on board with what Capracare is doing in Haiti, I will say that my life actually would have been a whole lot easier if I had never met Jean-Pierre Louis. But it wouldn't be nearly as blessed.
Aww.
And you know what? Jean, it reins him in. It reins him in.
You know what it is this work is so crucial. And, whenever I come across wonderful folks like yourself, I just can't see, like, why not, So for me, it's like, whatever you can give is gonna be a contribution, whether it was 1% of your time, 2% of your time. So for me, it's like, I'd rather get whatever percentage you can give, we can work from there. But not, having zero is not a good thing. But anything, whether it's 1 or 2% of your time, it's better than nothing. And I always feel like, there can never be a good time, the perfect time, right? For us to do whatever that we want. We just have to be in it. Once we are in it, then we can evolve, make the adjustments, given our whatever's going on in our life. But if we ever have to wait to get in, then something else is gonna take the time, something else. And I'm afraid that I'm gonna lose you to somebody else or something else that's gonna take your time, and I'm not gonna have your time. So I couldn't have a better two physician on our team, especially given the importance of this work, and two people who get it. So
John, let's talk about that for a minute. Dr. Helen and Dr. Sophia, I've heard you both talk passionately about why this work is so critical and why it's so critical in Haiti, why it's such a problem in Haiti. Dr. Helen, I'll start with you, and Dr. Sophia, if you will jump in. Can you just share? You're both women of Haiti. Can you share with us why this is such a problem in Haiti?
Well, it's a problem in Haiti, but it's a problem everywhere because us women, for whatever reason, we are caregivers to an entire household. but we're the last people who take care of ourselves. And oftentimes in countries where the means are not there, there are always bigger emergencies than our own health. So oftentimes women will actually forego their own medical care just to put food on the table. So it's an everyday choice that has to be made. And when, you know, given the opportunity to make the choice differently, very few women will actually say no. But I'm a cancer survivor. I'm a cervical cancer survivor. And I know that I wouldn't be here if I hadn't been screened when I got screened. So this is something that touches me personally, because I know that if I had not, you know, taken the measures to go through screening as I should have, I would probably not be here today. And this is a silent killer, in the sense that we don't have any symptoms. It doesn't feel weird. It doesn't affect our daily lives until it's too late. So, you know, it's one of those things that we have to be, you know, very big on the prevention. Unfortunately, culturally speaking, Haiti is not a place where women's health is on the forefront. And it's sad, because women are the pillars of families. You know, you don't have a home until you have a woman inside there. And they hold the house. They may not bring the butter or the bacon to the table, but without a woman in a home, you don't have a home.
Well, when you talked about you are a cervical cancer survivor and you wouldn't be here if you hadn't been screened, Dr. Sophia, can you talk a little bit about why that's such an issue in Haiti? Why women aren't being screened in Haiti?
Well, first of all, you have to first think about the concept of awareness. It's the concept of even understanding that they needed to be screened in the first place. So from just the patient's perspective, knowing that that's something that actually needs to be done. But then when we move on a public health standpoint, or just from a medical standpoint, there is no national program, or there's no real prevention program in Haiti that is really doing the screening. So outside of women not knowing that they need screening, there's also nowhere for them to necessarily go to actually obtain that screening, at least not on a systematic national level.
We don't have the guidelines in Haiti that we have here. Here you have the USPS you know, task force that tells you that there are certain screenings that needs to happen at certain decades of your life. In Haiti, we don't have these things. So this is not something that is in the culture, you know, in the healthcare culture to do these screening. Unfortunately, in Haiti, until something hurts you, you don't really go to the doctor. You know, Haiti healthcare is very focused oriented. It's not preventive. Oftentimes it's when something goes wrong that you go check a doctor. It's expensive. We also have the problem of not having a pathology lab that's able to actually test to do the pap smear or to test for the HPVs. So that's another thing. And where we are in Fonfred, we're 7 hours drive from Port-au-Prince. So, you know, navigating specimens from one side of the island to the other one is also a challenge.
And then outside of that, I mean, so Dr. Helen points out the fact that there's only one pathology lab. And even with that one pathology lab, the cervical cancer screening tests are not at the forefront of what's being screened for, when you have so many other diseases, so many other things that are happening, for that one pathology lab to try to accomplish getting reports back. Oftentimes in private settings, which are expensive, at least in those scenarios, some women are able to get screened, and then those screening tests are actually sent abroad, whether it's, you know, to the United States or other Caribbean islands, in order for those things to be read, you know, and then the concept is also we're looking at accuracy. So when we're thinking about that, that's part of the larger problem where cervical cancer is concerned, aside from all the other things that Dr. Helen has already mentioned. So the fact that there are no symptoms until it's way too late. When women figure out that they may have a problem, it might be because they may have a little bit of a discharge, or a little bit of a smell, or a little bit of vaginal bleeding that's happening outside of their periods, but they don't put two and two together that might be an indicator that they may have cancer. And yet when you examine them, they have this big fungating mass. And so these are part of the issues at hand when we are thinking about cervical cancer in Haiti. Number one, there's absolutely no primary prevention, and the secondary prevention is dismal.
And if in fact a woman finally does go to see a doctor or a nurse, and some screening is done and it is determined that she has cervical cancer, if you live in Fonfred, Haiti,
There's also, where's the treatment? So where is she going to go for treatment? So she may need several layers of treatment, because in Haiti, by the time you find out you have cervical cancer, we're not talking about like here in the United States where we're finding out about cervical cancer when they are in stage 1.
Right.
Okay. And we're just talking about probably just a partial removal of your cervix as a treatment option. You know what I'm saying? Versus a woman who has, stage 3 or stage 4 cervical cancer that requires, surgical intervention. And actually at this point, there is no surgical intervention. Let's just start there. So when we're talking about a surgical intervention, we're only talking about stages 1 and 2. And then we have to talk about radiation therapy, which is non-existent in Haiti. So, I mean, there's just so many layers to this problem. And like I said, we don't have a concept at all of primary prevention. So primary prevention being specifically vaccination. There's no vaccination program happening at all in Haiti. And when we, as far as HPV, we know that the reason why women get cervical cancer is their exposure. And typically that exposure is at, sexual debut, okay, to HPV, high risk types of HPV. And if we could have primary prevention in terms of mitigating that conversion of HPV, the high risk types, then we would likely be able to have those women, basically avoid getting cervical cancer, But then now we go to secondary prevention, at least. So let's say we have no primary prevention. Okay, we don't have a vaccine protocol or a national program for vaccination. But if we go to secondary screening, which is doing a pap smear, as far as being able to detect the high risk groups, right? That those women who've been exposed to HPV and have cervical changes due to HPV. The problem with that is, A, like I said, the women don't know to come and do that. And B, there's no program. There's no place for them to go with a protocol and say, okay, even 5 years, even 10 years, even if we said, okay, we're going to screen women after the age of 30, because we do know some things about HPV, and that is that most women will clear the virus. But for those that don't, that's which is typically in their 30s and beyond, when we really see that HPV has become, extremely detrimental as far as leading towards cervical cancer, but we don't have that set up. So.
I always hear and repeat, because I hear this, that cervical cancer actually is clearly one of, if not the leading cause of death of women in Haiti, and the incidence of cervical cancer is higher in Haiti and other third world countries than it is, for instance, in the United States. Can I keep saying that? Is that true? I mean, is that your sense that that's a true statement?
It's unfortunately still a true statement. At the end of the day, you have, 10 or 12 women per 100,000 that die of cervical cancer in Haiti versus like 0.6 in the United States. That's a dramatic difference. And the only thing that's different is the fact that we have screening tools, but moreover, it's the fact that, as Dr. Helene had said, we have something called the U.S. Preventative task force. We have the American College of OBGYN that give recommendations as to when women should go to the doctor, how often, and what the screening program should be and what it should look like. And then women follow it because we are taught that we have to go to the doctor, you know, on an annual basis or at minimum every 2 years. And then in that time, we're able to discuss what perhaps may be different ailments and happen to have these screening tools, you know, done, such as a pap smear.
Well, can we talk a minute, because to me, there is some good news on the horizon, in that, at least in Fonfred and Torbec and places in Port-au-Prince and further north, but the use of what's known as the see and treat screening method of women, which uses, and I know my gynecologist grimaced when I said this, but uses ordinary vinegar in order to do this screening, which made it possible, by the way, for the Prospect Goshen Rotary Club to be able to fund a project like this, because not, if I understand it correctly, it is through vinegar that you can, the doctor or nurse can determine whether or not there's precancerous or cancerous lesions there. Either one of you can do a much better job of explaining what see and treat is, which is what is being done by Capracare and another organization in Maison de Naissance in Torbec. So, Dr. Helen, can you give us the basics of just what see and treat is?
So see and treat is basically, we use acetic acid, which is white vinegar, that we basically swab the cervical os with, and magically the lesions are more visible. So it allows us to identify them and to basically take them out, you know, with good margins to make sure that we've eradicated the lesion that we did identify during that time. And the importance of the see and treat is, in Haiti, once you have someone who's with you within, you know, the office, identifying the problem is one thing, but being able to get rid of it during that visit, this person doesn't have to come back, doesn't have to take time away from their lives, doesn't have to take time away from their kids or their husbands or whatever it is that they have to do to come back for treatment, is a big, big, big bonus. But, you know, see and treat is one of, you know, I'm going to say it like that, one of the easiest way and the most cost-effective way and, you know, efficient way of getting rid of lesions that we actually see.
Capracare has a great dream: to screen 25,000 women for cervical cancer. Every screening has the potential to save a woman's life. Your fingerprints, too, can be a part of this success story in one of two ways. First, you can take your support to the next level and become an active part of our mission by becoming a monthly donor. Join Changemakers, our monthly giving club, today. Visit capracare.org/changemakers to set up your donation. It's quick and impactful. The second way is you can contribute specifically to the Prospect Goshen Rotary Club's foundation to help fund the next cervical cancer global grant. This next grant, through the magic of Rotary's matching programs, will provide funding to screen more Haitian women in more locations. Log on to the Rotary Club of Prospect Goshen's website. It's www.pgrotary.net to read more about how Rotary is working with Capracare and other partners to rein in cervical cancer in Haiti. From there, you can contribute directly to the Prospect Goshen Rotary Club Foundation to help fund the next cervical cancer global grant. Be a part of saving lives. It will change your life.
Yeah, it allows us, so the cervix, let's just talk a little bit, and I'm just going to give you a very crude example of how this works here. So if my fist here were the cervix, the way that cervical cancer works is it starts from the surface, which is the part of the cervix that we can see when we look when we use the tool, the speculum, in order to look through the vagina and see. And so the cells, the start of the change happens here on the surface. And by applying the vinegar, we're able to illuminate basically those cells that may be problematic. And by being able to, either with freezing or with some form of cautery, being able to remove or basically stop those cells in their tracks, we're able to, as Dr. Helen has said already, see and treat in that same visit is so imperative, because many times these women, they come to you for that one time, they cannot even afford to come back.
They don't come back.
They cannot afford to come back, or they cannot take time away from whatever else they have going on to come back. And so the possibility of what you've done, let's say that woman now, the next time that she's able to come back to see a physician or to see a provider, is not for another 3, 4, 5 years. So by doing something like cryotherapy, you may have completely eradicated the problem in her, but at least even if you haven't, you've at least slowed down the process. So until she can come back, and so that's the importance of being able to do see and treat.
If in fact what you see, and I always refer to them as lesions, I guess, but if you catch the lesions in their precancerous state, then they can be frozen, and if necessary, cauterized, maybe. That I always say remove. My guess is that we're really talking about.
It is cautery. It's called a LEAP. It's an electrocauterization.
Okay, so if in fact we catch it in time, the woman literally goes home well. Is that right? I mean, if it does not become cancerous, is she that day, she may have come in with precancerous lesions, and you see and treat her, and she goes home well.
Yeah, there's very minimal downtime. She may feel a little bit of crampiness, and in some instances may have a little bit of spotting or discharge. But in all honesty, she's well enough to definitely go back to her life, and even if at worst case scenario, like I said, she may have some cramping, some discharge, and some discomfort that may keep her home, which is very unlikely in a Haitian household.
It's not going to happen in Haiti.
24 hours. You know what I'm saying? Perhaps for 24 hours, she can say, I went to the doctor, I had a procedure, I had a process done. And so therefore I need a little bit of time. But overall, the best part about the concept of see and treat is the fact that they can go back to their life and know that this problem that they have is really it's mitigated the possibility of the progression.
Okay, so are you just not blown away by the fact that there aren't all kinds of organizations or groups or doctors and nurses doing this all through Haiti? Why not? Literally, and my information is it may not be very good, but it is my understanding and talking with other groups that at least in the southern part of Haiti, south of Port-au-Prince, Capracare and Maison de Naissance, and then there's one other group, and it's on the other side. I always say the Fon Fred is at the toe. They're basically on the heel. They're at the bottom of the foot, but they're close to the toe. And there's another group that's close to the heel that is doing see and treat. And that's it. That's it. There isn't anybody else doing it.
But we have a cultural component that we also need to address, is that oftentimes when we start talking about genitalia and we're talking about things that are sexually transmitted, there's a big education that needs to happen. And, Haitian women are not complainers. They're not going to complain. So a lot of time they just push through a lot of things. We all have this flaw. We don't get to where we are today without pushing through, hardship and hurdles and putting ourselves on the bottom of the totem pole. So a lot of times when we talk about things that are sexually transmissible, it starts raising the question of our culture, where our men are not very faithful. And it's also, pointing fingers in directions and having conversations that are difficult. So, not everybody is equipped to have those conversations. Not everybody wants to listen. And the educational part of what it entails to actually have someone agree to allow you in this utmost intimate part of their bodies is a big one. Also, the fact that there's a lot of questions about fertility, in our population, fertility is a big component as well. So, if there's a slight risk that this could actually affect her capacity to have children in the future, it's not going to be welcomed very well. So there's a lot of that in the equation as well that we also have to address. Why did Capracare decide to do that? I couldn't answer the question. I'm happy they did, because again, this is something that speaks volume to me personally. I left Haiti in 2010 after the earthquake, and I was doing a lot of work in Port-au-Prince in terms of prevention already. I was doing a lot of work, with a lot of other problems that we have in terms of, childhood prostitutions and things of that nature. And this is when I realized how young, our population was, affected with things that are culturally inflicted upon them because of the fact that our men refuse to protect themselves.
I also think it's not because there aren't other organizations or, I was going to Haiti after the earthquake in 2010, 11, 12, 13 with other organizations. But what happens is that the country itself can sometimes make things very difficult. The organization, the coordination of trying to make the care happen. So that's one in terms of attempting to do screening. Number two, I would say that the awareness, not just the awareness, I should say, the physicians that are there, you have to take into account how many actual OBGYNs are there. And when you have also a large population of doctors, nurses, that once they get their degrees and they're trained, there's another portion of them that actually leave the country. And so we have to take that into account as well. And again, as if we were talking about Haiti just as it is right now, so I'm not even talking about Haiti 10 years ago when I was going 3 times a year. If we talk about the insecurity of Haiti now, it again makes it difficult to have some of these programs. We're very fortunate as Capracare to be able to not only do the kind of work, but because we're able to enlist help from the actual local people, the people who are already there and on the ground, is what makes Capracare, unique and different with the abilities that they have. And all of the organizations don't have that kind of access.
And Capracare does a lot of teaching too. They do a lot of community outreach. So there's a lot of talk before those days are scheduled so that, the population is aware that there will be screening. There's a lot of education that takes place before that happens so that, all the questions are pretty much answered. All our team members on the ground actually live in Fonfred, so they're part of the community. So there's a trust level there as well. So, these are all blessings that if we take an organization that's coming from somewhere else and just implant it over there, there are foreigners coming in our territory. And, the trust level is not the greatest because again, you know, do they know what our reality is? Probably not.
Well, you know, and in my club, we actually, before we met, you, Jean, we worked with a OBGYN based in the United States, based in Louisville, Kentucky, who was trying to do this in, he was actually north of Go Naive, who's trying to do this in Go Naive. And he just couldn't get it off the ground. I mean, he could not get it off the ground. And Jean did a great job in schooling us in how for much of anything to work in Haiti, you need Haitians on the ground who are
Of
running
course.
that show.
Absolutely.
And
Yeah.
you know, and when you also talk, what was amazing to our club, because I mean, so we get the global grant. Well, we have to report numbers. I mean, Rotary International wants to know numbers and how their dollars are being spent. And of course, it's really nice when somebody says, well, you know, are you saving enough lives to spend that kind of money? Well, I don't know, one life, $1 million. I think we're doing really good here at the, but the number that always struck me when you talk about outreach, there would be a large number of women who would come to the outreach functions, and maybe, Jean, 40% would come for the education. You know, that was step two. Here's the opportunity, and then 40%, in order to be screened, would have to go through the education. Well, those who are educated, my word, it was close to 100% who did the education to the screening. But to get the that 60% who heard about the opportunity and for whatever reason decided it was not for them. But I would agree. Capracare is the folks on the ground. Your folks are just amazing, Jean. And we actually will talk in one of the further episodes about how candidly, your folks are some of the most resourceful people I have ever met in my life. But for us, we are thankful that we actually found you, Jean, and had this opportunity through the use of See and Treat, which I will tell you, in Rotary world, it's an easy sell, because just think about that. You can say through the use of ordinary vinegar and a global grant of under $70,000, you're in the business of saving lives, a bunch of lives, you know, and that's just that's a problem. Now, I've been working at this with Jean. We've been working at it for 7 years. I think I've been working at it for 9, and I thought maybe that we could solve this problem in my lifetime. I'm not so quite sure anymore that's going to be in my lifetime, but it'd be in yours. It'd be in your. It is feasible to really rein in cervical cancer. And yes, we know about the vaccines. And the issue with the vaccines in Haiti has to do with
That's
no.
another cultural, I think that's another cultural, pardon me for interrupting, but I do think that that's another cultural, impact there in terms of the vaccination program. I mean, even if we have a vaccine program, it would be then to convince
Right.
women to actually get vaccinated or have their children vaccinated, because that's really where the impact is made. We're talking about vaccinating young girls at the ages of 11, 12, 13, 14. And unfortunately, there is this connotation that, oh, if you vaccinate women, or women, these adolescents, that's somehow that's a license to have sex. You are now opening a conversation about sex that Haitians are simply not willing to have, certainly not with their children. They don't have it as adults.
They don't have it as a couple, so
You know, and so now we're introducing the concept of a vaccine that helps prevent a sexually transmitted disease, a concept that is totally taboo, and a conversation that is completely unfamiliar. So there are a lot of hurdles when we think about how to do a really great job with prevention, certainly if you're talking about primary prevention.
the other thing too, which I think Capracare is helping quite a bit with, is that even though, let's say we have 100 women that come in for the education and only 40 or 60 actually get screened and tested and we find something that we treat, the fact that their recuperation was flawless and that it was not as painful as it may have been anticipated, that spreads the word so that the next time we have something, it's kind of, I'm not gonna say, you know, it's minimized, but it kind of is like, it's not a big deal. Just get it done because it's really not that big of a deal. You know, you're not gonna be uncomfortable. You're not gonna be bedridden for 2 days. You know, it's not gonna stop you from doing your stuff because women talk. You know, we're known for that.
And they'll talk about that kind of stuff.
Yeah, amongst themselves, they'll talk about that kind of stuff. They're not gonna talk about, you know, the importance of vaccinations or things of that nature, but they'll talk about their experience. So this is also why it's very important that we have, you know, Haitian boots on the ground, because they'll be more likely to allow that invasion of privacy from someone who understands them than from someone who's just, you know, a foreigner in their environment.
Well, I know when Jean, you all were working on the outreach and education prior to the time the clinic was actually set up and your doctor and nurse were trained. I mean, all of that was done first because as a part of the training, we wanted to actually screen women. And there was some concern about whether or not any women would be willing to come to to be screened. And yeah, like that wasn't a problem. I mean, they had to they actually had to organize the education sessions because they were too full. They were too full. So that was great. I do want to take a minute to ask you about the other method of screening. I would call it almost a pre-screening that's taking place in certain parts of Haiti, and in fact in one of the organizations we're working with, where they use a swab test. It's a self-test where the women test themselves, and then those swabs are tested. Dr. Sophia, what do you know about that?
Well, what I know is that it's by women doing the self-swab, they actually are a lot more comfortable to do this type of screening because they don't have, as Dr. Helen has said many times, the invasion of kind of like their bodies, etc. With the self-swab, the swab then has to be transported, though, in order to be read. What we're looking for with the swab is the evidence of HPV. What the swab checks for is the virus. So by doing the swab and identifying those women who do have high-risk HPV, that's definitely secondary prevention at its best, in the sense that it's a simple, cost-effective method that most women can be easily on board with. But we go to the other problem when we're talking about Haiti, which is what do we do after we've collected the swab? So without an organized program for actually executing this, though it's a great method, especially in low resource settings, Because at that point, then outside of having to screen hundreds of women, now we have identified those who are truly at risk, and then now we can bring them in because we with the swab that they were self-collected. It's easy. You put in basically what looks like a Q-tip into the vagina. You twirl it for about 10 to 15, 30 seconds. You take it out and it goes, but it has to be tested. It has to actually go to a lab. And that is where there is the rate limiting step when we're talking about Haiti.
And also, getting this woman back in the office so you can do some sort of intervention is a challenge. That for me, the test and treat is the best method, because again, once you have the patient in the office, it's like you see it, you get rid of it, she goes home, and that's the end of the conversation. Now you did the self swab, great. You have positive HPV, okay. If it's reflex to the big ones that could actually cause cancer, you have to get this woman back in the office. She may not have the physical time, or she may not be able to free herself from her obligations to come back. And then what did you do? Now you're living with knowing that there's a walking HPV in the community and you can't do nothing about it.
Now, for the women who actually are identified as having HPV, when they're called back into the office, are they not then, don't the doctor or the nurse, do they not do see and treat then?
I don't know whether they do see and treat then. I would assume they do. I don't know if they do a colposcopy. I don't know if they do cryo. I don't know if they do LEEP. But to me, the fact that there's a self swab, I've already lost half my window.
I think, again, the thing is that it has to be doing the actual self swab portion of it is great. It's having but we have to have the full protocol and execution of it is where the real problem is. Self swab is fantastic because it's the method that most women would prefer. The problem is, as Dr. Helen has said, is getting those women back in to actually be cared for and undergo the form of treatment, which likely would probably be something very similar to see and treat. One of the differences is that if you are able to identify those high-risk groups, now instead of having a screening, a day, let's say where you have 200 women that are coming through to your event, now you can identify in the community the 40 that really need your attention, and so you can have even more focus in terms of how you liberate your resources. So there's a bit of a
give and take.
Yes.
They're trade-offs, and and actually, when you talk about a process in place, I think, Jean, about your mobile clinics where you go out to the hinterlands, 3 or 4 different places on a somewhat regular basis, and and I can see, because you go back. You go to the women, they come so that they come to, it's easier for them to come to you, and then you can go back, that possibly may work. But there's no doubt that based on how you all work, the see and treat method has really proven itself to work. I mean, the women have become comfortable. I remember vividly the woman the week that we were there, when she talked about how they now had hope that they wouldn't die from cervical cancer because we had come. You want to talk about changing a life? I mean, how do you say no to that? How do you say, how do you turn your back on that? But it's so to me, that actually is the good, that it is the good news, in that at least in the world where we operate in Haiti, we can bring hope to those women. To me, that's why we got to keep doing it, isn't it? I mean, isn't that why we do it?
We have to keep going. We have to keep trying. We have to keep educating. with every woman that's educated that in terms of how her body is functioning and how she can help protect her body, it's another woman that we can potentially save. And so even if it's just like you say constantly, even if it's just one. So the fact that Capracare is able to educate on a grander scale in an area of Haiti, again, that's remote. That is the countryside. That's not even Port-au-Prince. We're talking about very far from Port-au-Prince, at least 3.5, 4 hours by travel.
7.
You see what I'm saying? Even more. You know, I'm thinking, well,
and also
if you can pass the roadblocks as well.
Right. So the thing for me that's also important is that when you have touched a woman in that way, and that woman has children, she is now telling her children about prevention. So we are touching the generation that's coming after, and hopefully we'll have a generation that believes a little bit more in prevention than the generation that is there now.
You know, and so I'm just always grateful. I'm always grateful after talking with you all for the role that you play that makes it possible for those of us who are not doctors and nurses or who are not working in Haiti to actually have a fingerprint in Haiti in saving lives. It really is spectacular. Don't ever underestimate the positive influence the three of you have on me and everybody in my club. I'm just grateful, you know. And on that note, I'll just say you all inspire us to keep on trying, and we will. Next time, we hope that you'll come back. We'll hope that our listening audience and those of us who are watching on YouTube, that you'll come back. We are going to talk a bit about the challenges that we encountered in trying to get this project off the ground, and in fact, have encountered along the way in trying to bring this see and treat screening method to the folks in Fonfred. It's possible if you come back, you just may be inspired. We'd love to see you. Have a good rest of your day. Thanks for being a part of our time.
Thank you, Jo Ann, for having us again.
Amazing. This was such a master class.
Thank you, thank you, thank you.
Let your fingerprints be a part of this success story. Log on to Capracare's website at www.capracare.org/changemakers, or go to the Prospect Goshen's Rotary Club website at www.pgrotary.net to donate today. Together we will save lives. You can also help Capracare's mission by subscribing to this podcast and leaving a rating and review. Thank you for growing our listening community.